Welcome to the Deep Sea Journey Foundation educational channel. I'm your host, Terry Kuti, and the founder of deepseafoundation.org. I am extremely pleased today to welcome my guest, Lucy Thompson, who is a paramedical tattoo artist from the UK. She will be sharing a presentation with us in a little bit today that will inform and inspire you. I'm going to put in the notes a TEDx NHS talk that Lucy did. It is absolutely mesmerizing. I know it mesmerized me because she's going to tell us that there is a better way. Lucy, welcome to the channel, and thank you so much for joining me. I see your lovely holiday tree in the background. We are filming this during the holiday season, so happy holidays to you.
Happy holidays to you as well, Terry, and thank you so much for having me here today. I'm really excited to be a part of this and to talk about such an important subject.
Well, thank you. Do you want to just begin, Lucy, by telling us the story behind, before we start the presentation, do you want to tell us the story behind your work and really what inspired you to work in the breast cancer community with the NHS?
So my history is my background. I'm a traditional tattoo artist who's always done body art tattoos, and quite early on in my career, I was fascinated by working with scars and how they would help people. And I was asked to do a nipple tattoo one day, and I'd never heard of one. I thought, what do you nipple tattoo? Let me have a think about this. Let me look into it. So I actually brought the subject up with my auntie because I'd known she'd had a mastectomy. And to be honest, she didn't want to talk about it. She said, "Yes, I had a tattoo. I don't want to talk about it." And she was really closed off. So naturally, I kind of gently pushed and sort of I wanted to know why she couldn't talk about a tattoo. It shouldn't be that much of a bad experience. So she eventually opened up and told me that she'd had a really negative experience in the hospital by her surgeon in the theatre, and the tattoo experience itself was, sorry, physically extremely painful. There was a lot of bleeding, excessive scab, and the tattoo faded away. And she
Mm.
kind of told me then that was 10 years ago, and I just haven't looked at my breast since. And it was at that moment that I just really felt, why? Why have you been through this? Why have you been living a life without feeling like you can look at your breast after you've beaten breast cancer? And then I started looking into it, and I found that actually this was just the standard that was offered in hospitals throughout the whole of the country. Surgeons or nurses were put on a very short 2 or 3 day course, so would learn how to tattoo. Then they were tattooing people. So as a tattoo artist who's done a 2 year apprenticeship before I tattooed healthy skin, I realised that this was obviously an issue, and this is why maybe people are feeling extreme pain and then the tattoos are fading away. And I didn't think it was fair. Um, so after I actually travelled to Texas to learn how to do 3D realistic nipple tattoos in 2017, because no one was offering that option in England anywhere. I searched high and low, and then when I returned, I started offering them for free just to anyone that would need them. And I was hearing the same stories again and again, and the devastation that these people felt after the tattoos had faded. And I just felt like this shouldn't be happening, and why is it happening on such a large scale? So I think I did my first 50 tattoos for free. My regular tattoo work sort of covered the costs of them. And then it got to a point where I was just really quite inundated with requests. I was struggling to manage the waiting list. People were struggling to wait because they knew that there was a solution to the problem. So I actually decided to start a charity to cover the costs of these tattoos and also build a directory of artists throughout the whole of the country, because some people were traveling from the very top of the country right down to me to the middle, or from the bottom all the way up. And I know that that's not always something that people can do. So I thought, if we could if we could raise some money to cover the costs so people don't have to pay for them, that would be amazing. And if we could build a directory of artists so people could access this service more freely from a trusted artist in their area, then that would be fantastic. So in 2018, the Nipple Innovation Project was born, and we've just grown from strength to strength over the past nearly 7 years now, which is really exciting.
This story resonates with me so much, Lucy, because, I started a charity here in the US, and to listen to the time frame you did this in, and you had a call to action and you answered the call. I'm impressed. I'm impressed.
Thank you.
I will just say that. So it's called the Nipple Innovation Project, and we'll put a link to that also. Do you have some slides that you want to share with us today to do a presentation?
Yes, please. Yeah.
All right, I'll let you go ahead and pull those up.
Thank you.
Lovely.
Right. So I'll just run through again a little bit more about us and our charity, what we do. So
Mhm.
we are the first mastectomy tattoo charity to exist in England and Europe, I believe. We've been running since 2018. We are completely run by volunteers. Everyone that helps us run the charity gives us their time, which is just the most beautiful thing ever. We were created to offer an alternative solution to the patients that need these tattoos. And also, our goal was always to work with the NHS, which is the National Health Service over here, which is where we pay our taxes and contributions help us enable to get free healthcare. And when it's good, it's really good. So the charity also raised funds to cover the cost of these tattoos because we feel very strongly that choosing a higher quality option, finance shouldn't be a factor in being able to choose the best option available to you. We are slowly building a very strong UK directory of specially trained, experienced artists that we check and vet to make sure that they're all offering a safe and consistent service. We understand the psychological importance of these tattoos. They are considered a cosmetic treatment in hospitals, but we argue that they are a lot more than a cosmetic treatment and they're essential to people's healing process.
Mhm.
That's just a little bit about us.
Well, I'm going to give a shout out to your volunteers because as a nonprofit leader, we can't do what we do without our volunteers, can we?
Exactly. Yeah.
I'm so glad you honored them. So I see the at NIP charity. So that's good. I'm glad that's referenced down there in the corner. I see that. Okay.
Yeah, we are just touching on that as well. I always say to them, time is the most precious thing that we have. So to have so many people that are willing to give up their free time to support our cause is incredible.
Mm,
And it's beautiful, and we are so blessed to have that. And we seem to be growing in numbers every year. So I think that's a really good testament to our mission and the people that we're helping and the impact that we're making as well. So
I do
I'm very
too,
glad.
Lucy.
So yeah. Um, so I touched on it sort of in my introduction, but we some people might not know what the difference between micropigmentation is, which is what's offered in hospitals, and some people might not know what tattooing is or traditional tattooing. So to tattoo someone in a hospital, you are only required to do in the UK a short 2 or 3 day training course. This is with no previous tattoo experience. And then you are considered qualified to be able to go and tattoo over scar tissue. Um, and to give a comparison to that, to become a tattoo artist, it takes a 2 year apprenticeship before you can tattoo healthy skin on like easy body parts, like usually arms and legs is what you start on. Because different body parts with curvatures and different types of skin can be a lot more challenging to tattoo. So we focus on working on fake skin, then healthy skin. Scar tissue comes a little bit further down the line once you've got more knowledge and experience on working on healthy skin.
Mhm.
Um, so micropigmentation techniques are also used for permanent makeup. So if people choose to have their eyebrows tattooed or their lips tattooed or eyeliner tattooed, that is the technique that will be used, and it's used because the idea is for the tattoos to fade away. So when makeup and fashions change, people can update their makeup and their like maybe their eyeliner style or something to adapt to the fashions that they change.
Mhm.
And that is why micropigmentation techniques are used. The needles are a lot smaller, the machines are a lot more gentle. It's all designed to encourage for the pigments to work their way out of the skin. Um, so obviously for traditional tattoos, these are permanent tattoos, they're permanent body art tattoos, and we don't want those tattoos to go anywhere. So the machines are designed to implant the pigment into the skin, and for it not to go anywhere, we use larger configuration needles so we can cover more surface area in less amount of time, causing less trauma to the skin, and obviously not causing any more damage. So the issue with not having tattoo experience and using semi-permanent or micropigmentation techniques, which are suitable for like really small areas of the body, like eyebrows or eyeliner, to
Mhm.
then use those techniques over scar tissue, you are inevitably going to cause more damage to the skin unless you are highly skilled and highly experienced practitioner. Um, I'm not saying for 1 second that this is done intentionally, but this is why tattooing is a long process to learn. There's no replacement for time physically spent in the skin tattooing. And that's why we, as a traditional tattoo artist, have an apprenticeship. So unfortunately, we see a lot of overworked medical tattoos done in hospitals simply because people just don't have the experience in tattooing. They often don't know when to stop. They don't know how to read the skin if they've overworked it. Sometimes some go too deep as well, so they do cause further scarring to the skin, which is really quite devastating to the wearers. So, um, yeah, so that's just kind of a little bit of an explanation about the difference between micropigmentation and traditional tattooing.
I love your term read the skin because with breast cancer patients, not only do you have scar tissue, but you also have the effects of radiation.
Exactly,
Yeah.
exactly.
Mhm.
And multiple surgeries, people might have had multiple reconstructions, they could have had delayed healing, they could have had so many different treatments which will affect the integrity of the skin. So
Mhm.
it's so important that people have experience in tattooing and knowledge of tattooing, um, so they don't cause further damage to people because it is very easily done
Mhm.
if you don't have that experience.
Yeah.
So here are some examples of faded and overworked tattoos
Mm.
done in hospitals. So these are quite hard to see. These are just 5 images that I've put together for this slide, but I have hundreds of these, unfortunately. The center one, you can see that there's very white circle. There's a patch here. Um, that is actually, you can see the thin surgical scarring around the edges. That is from the reconstruction. The white circle that you see inside is from somebody going too deep with a tattoo machine
Mm.
and needles, basically. And that is just absolutely heartbreaking to see that someone's just gone so deep that the skin has just fallen off the body, basically.
Mm.
And we see this time and time again. And people are often living with these, and a lot of people that I meet, which is really sad to hear, um, they say, well, I'm just grateful to be alive. I don't want to cause a fuss. I don't want to go in and say, I want more or I want better. People, I understand that they're grateful, but our argument is you should be thriving after everything you've been through for the sake of something so physically small. Like you deserve to have that feeling so you can accept your body after everything you've been through, and you can move forward in a positive way because you've been through a lot to get to that point. So it's really
Mm.
sad to hear and see a lot of this a lot of the time. And by all means, surgeons, nurses, practitioners, whoever does this work, absolutely they're doing this with the best intentions. But unfortunately, there is no shortcuts to learning how to tattoo. And these are examples why it doesn't work.
Yeah, and I hear that from your colleagues here in the US as well, Lucy, who I know you are in touch with. We've
Yeah,
spoken about that offline, so I'm really glad that you've shown these examples and we know what can happen.
yeah. So, as I mentioned, a lot of people were feeling unhappy with their tattoo, yet they felt grateful to be alive. They didn't want to cause a fuss. Now, over the years of us doing this work, there's been a lot of resistance in us trying to just let medical professionals know that we exist. I think there's still some kind of stigma associated with tattooing. I think they think that we're also bald bikers that sit around smoking on our motorbikes, which is just not the case at all. Um, and I think there's a lot of misinformation surrounding tattooing. So there is a lot of people, including ourselves and people over in the US, who are working hard to show that that is not the case and that actually we are professionals and a lot of us work from private safe spaces. Um, and at the very least, we ask hospitals if they're not willing to work with us, if they would consider letting their patients know what options are available so patients can make that choice for their body by themselves. In the first few years, we were finding out that no, we didn't know. We'd reached out to hospitals. Hospitals weren't telling people that we existed. Hospitals were saying there was no other option. You had to get this or nothing. So people were being left kind of constantly going back for this top up for 3, 4, 5, 6 times, dreading going back to the hospital, dreading getting excited because they've got a tattoo, dreading seeing it fade again multiple times later, but feeling like they didn't have a choice, they didn't know of any option, any other option. So we ask, okay, if you're not willing to work with us, that's fine. But at the very least, give patients the full information so they can make their own informed choices.
Hmm.
Let them know that the tattoos would fade because previously they might not tell them that. Um, or at least say there is a charity that offers these for free. Well, we can signpost you this, we can offer you that solution. So it has been hard over the years. There's been a lot of resistance. So we actually decided to conduct a little survey to kind of gather some data so we could represent the people that were telling us these stories. So I'm going to share some of the results from that with you now. So I think the survey was from up to around 100 people, and 81% of breast cancer survivors who received hospital tattoos were very dissatisfied with their results, which is obviously a very high percentage. 51% of this group suffered adverse mental health effects due to the poor quality of their areola tattoo. The majority of comments left were based on how sad they felt when the tattoos faded and seeing further scarring after their tattoo procedure. Mentions of increasing depression and low self-esteem issues were repeated. And a little comment that was left, which has always stuck with me, it's devastating to hear that someone felt this way. After the tattoo had half faded off, I felt more embarrassed about how it all looked than I did having no nipple. I felt like it was the biggest mistake I'd ever made, and I often used to bathe in my bra through not wanting to see it.
Oh my.
Just,
Mm.
just shocking.
Yeah.
Just, no, it's just not fair.
No. Wow.
Here are some examples of 3D realistic nipple tattoos that I have completed. So, as you can see, they are all different, they are all unique. I and Nip believe that everybody should have access to a unique and realistic option. Especially if they've had a unilateral mastectomy, why shouldn't they have a nipple that matches their natural side? That should be the absolute bare minimum that everyone has access to. And as artists, I feel it's our responsibility to learn the craft continuously so we can be the best that we can be for the people that we are helping, because we are replacing a body part at the end of the day. This is not a cosmetic tattoo that you get in because you don't want to put your lipstick on every day. We have a huge responsibility in doing this work, and the least we can do is work on our craft, perfect realism, so we can give people that need these tattoos the best result possible.
In my estimation, Lucy, it's a completion of breast cancer surgery and breast reconstruction.
Yeah, it's a way of like, some people call it the cherry on the cake.
Yeah, exactly.
So there's something over here that we do, which is basically we can request freedom of information surrounding things that happen within the NHS. So we can try and that means that we can find out, we wanted to find out what this was costing the NHS, so we could offer a solution to this. Um, we found that the costs to the NHS were anything from £354 up to 856 per session. That obviously fades away, which is quite a lot of money.
Mhm.
We found that surgeons and nurses were often performing these tattoos in theatre, where their time was already stretched. So then they were using the time of the surgeons in theatre and all the resources that go with theatre as well. Obviously, we found out the training that's required is very, very minimal, and that any clinicians that offer this service don't have to have any experience in tattooing before they take on this training. So, as a charity, we've worked very hard over the past few years to basically offer a solution to all of these issues. Um, One thing that I hear time and time again is that people don't want to go back to hospital for this treatment. They're often 1 or 2 years down the line after their reconstructive surgery, and the last place they want to go for a tattoo is a hospital. Some may feel differently about that, but the majority of them have said they welcomed visiting a private, dedicated space, where it's almost like a celebration of the part of the journey and where they've been on. And it's really nice to have that feedback from people and to know that they can come to a safe place and they don't have to relive any negative experience they've had throughout their treatments.
Separated from the surgical ward of the hospital. And I love that you're calling it a private, safe place.
That's exactly what it is.
Yeah.
It's important. So, very proudly this year, we were the first mastectomy tattoo charity to partner with the NHS, which has never been done before. And we are extremely proud of this partnership. And we are working with the trust to develop a program that we can use at other trusts where we have other artists on the directory. Um, they understand that this is a cost-effective solution, it's reducing massive waiting lists, and it's also hugely increasing patient satisfaction, which is the whole reason why we do this work. So to get feedback from their patients and their staff and the surgeons, they are just so excited that they found a solution to this, and people are feeling good again and they're feeling happy. So we are really, really excited to develop these partnerships further throughout more of the UK and to continue working with the NHS. And with our goal being eventually the Nipple Innovation Project is the trusted charity to offer this service throughout the country. So we are very keen to explore the psychological impact of this work, and we are very keen to do some research, some academic research on this topic. There are some very basic kind of research studies on this, but nothing in depth. And we want to, we're very keen to work with some professionals to do this further, and also touch on research how people feel when the tattoos fade away, because there's not actually been anything about that. It's all just how they feel immediately after the tattoo. So we feel once we're able to work with some professionals and gather some real qualitative data, this will help us with our mission more. Once people see actually the huge impact this has on someone's self-esteem, confidence, mental health, which also affects their ability to rebuild relationships with themselves, their partners, family. Honestly, I've seen people being able to get a job, and I've seen women tell me they've been able to be intimate with their partner after many, many years because of these tattoos. Like the power of these tattoos cannot be underestimated. So,
I know this is giving me chill bumps because I think about the revenue cost alone, Lucy, and you talked about women being able to get jobs again. You and your colleagues can be this transformative for a woman to enter back into her professional career with confidence or to gain her confidence with her sexual partner. I mean, there's so many layers to this,
yeah,
and yeah, so inspired.
thank you. It's No one talks about nipples, do they? No one, there is a stigma around it, and I think that this is why maybe it's not discussed more because people feel some sort of shame or embarrassment if you bring it up, and a lot of people don't know that nipple tattoos exist unless you've needed to have one or know someone that's had one. So I'm really, so I'm grateful to be here today, Terry, so I can hopefully inspire people to have those discussions a little bit more and ask, what do you want for your body? What is the best thing that you want? You're okay to ask for more. There
Mhm.
is options out there, but unless we have these discussions, then I think a big part of um reach and for us is awareness, people feeling comfortable in talking about nipples basically and letting people know what is possible. So yeah, that's the end of my slide. Thank you for watching, and that was just a little touch on what we do and how things work behind the scenes. So yeah.
Yeah, well, if you want to quit screen sharing now, Lucy, I thank you. I mean, thank you. The thing of it is, one of the things I remember most about your NHS TEDx talk, you said every mammal on the planet has nipples. Why
Yeah.
aren't we talking about it more? I think that this is kind of out of the realm of what surgeons have been trained for. We
Yeah.
each have niches, we each have specialties, and I'm so proud of what you've done, and I'm so honored to have you on the educational channel today to bring this awareness. The more we talk about it, the easier it will become, and
Yeah.
the more people will have access to it. So I just want to thank you again for the beautiful presentation, the wonderful story, and for taking time to be with me today.
No, honestly, the pleasure's all mine. Thank you for having me. It's just, yeah, it's a pleasure. It really is. Thank you, Terry.
All right. Thank you, Lucy.
Thank you.